So welcome everyone. So discussing endocrine system diseases and disorders, and I hope each and every one of you has their case studies ready for presentation. So I hope you all went through your study sessions. So anyone, if we may go through the case studies, who would want to start with presenting their case study?
Yeah, I can start.
Oh, all right, Sister Julia, please do.
Yeah, my case study. Sorry, shall forgive me, I've got flu, so my voice is a bit worse.
Oh, it's okay. We can hear you perfectly well.
Okay. My case study is a 35-year-old man came to our clinic complaining of deformation of coarsening of the facial features and enlargement of the hands, feet, head, and tongue, increased sweating, thick, coarse, oily skin, chronic sinus, congestion, headache, weakness, joint pain, vision disorders, and numbness. What could be the etiology of this patient?
Can you just repeat the symptoms for me? Sorry, I hope you can hear me.
Pardon?
I said, can you repeat the symptoms?
Okay. The man came to our clinic complaining deformation of coarsening of the facial features and enlargement of the hands, feet, head, and tongue, increased sweating, thick, coarse, oily skin, chronic sinus, congestion, headaches, weakness, joint pain, vision disorders, and numbness.
And you want the etiology?
Yeah, I want the etiology.
Okay. I think this disease may be caused by tumors, slow-growing glandular tumors in the anterior pituitary gland.
Yeah, sure. And what could be the disease?
It's hyperpituitarism, also known as gigantism.
Yeah, sure. Then what's the diagnostic procedures?
Well, hyperpituitarism.
Okay.
Oh, okay. No, you can go, Sister Jason.
Okay, so reading on the PowerPoint, it says that the diagnostic procedures are clinical picture of symptoms, glucose tolerance test, MRI, MRI, and CT scans, and bone X-rays.
Yeah, sure. Then what's the treatment?
The treatment involve lowering HGH levels to normal land, stabilizing or removing the underlying tumor and minimizing damage to the pituitary gland. Yes, surgery may be performed, radiation therapy.
Yeah, sure. Thank you so much. That's my case study. I will share the link when I submit my case study.
Okay, so you did some more research on the disease.
Yeah, sure.
Okay, that's wonderful. Thank you.
You're welcome.
So any next volunteer?
I can go next.
Case study?
I can go next. I hope you can hear me.
Yes, please, we can. Thank you.
Okay, great. A 30-year-old woman presents to your clinic with symptoms such as polydipsia, dry skin, weakness, fever, and mental confusion. What do you think the disease may be?
You said weakness,
Oh, is it
fever, and mental confusion.
Yes.
Isn't it diabetes?
Diabetes.
Okay. Is diabetes insipidus?
Yes, that's correct. So diabetes insipidus occurs when the kidneys are unable to conserve water. Decreased vasopressin, also called antidiuretic hormone, ADH, allows filtered water to be excreted. Who can give us the etiology of diabetes insipidus?
Tumors, hypophysectomy, which is the removal of the pituitary gland, skull fracture, head trauma, inherited or caused by kidney dysfunction, higher than normal levels of calcium in the blood.
That is so true. Well, as for the signs and symptoms, like it was presented in the case study, we have polyuria, polydipsia, which is the excessive thirst. We also have dehydration, dry skin, weakness, fever, mental confusion, and prostration. What are the diagnostic procedures for diabetes insipidus? Sister Tika Benji.
the diagnostic procedure is urinalysis, sorry, urinalysis, dehydration testing.
Thank you so much. That is so true. The treatment, Elder Gatere.
Okay, so the
Elder
treatment is,
Gatere, are you with us?
yes, I am. Can you hear me? Can you hear me, Sister
Yes.
Chris? Okay. So the treatment, it says treat the underlying.
Yes.
Okay. Treat the underlying cause if possible, fluid intake, hormone replacement therapy, vasopressing medications.
Yes. And the prognosis depends on the underlying cause. If the underlying cause is difficult to treat, prognosis is guarded, and there is no prevention for diabetes insipidus. Does anyone have a question?
Not on my side.
Okay.
Okay, so if that's it for case study, thank you so much. I think I can go next by presenting mine. So mine reads as follows. A 29-year-old male presented into our clinic with symptoms such as moderate thyroid enlargement, which is accompanied by pain and tenderness. So we ran some blood testing that will reveal elevated immunoglobulin levels and the presence of antibodies that react to thyroid disease. So what do you think is the disease? So the symptoms are moderate thyroid enlargement, which is accompanied by pain and tenderness.
Is it Hashimoto thyroiditis?
Yeah,
Yes. Yeah, it is. Thank you. Okay, so description is most common cause of hypothyroidism. So inflammation of the thyroid gland, also known as the autoimmune thyroiditis, which is more common in women than it is in men. So what you guys think is the etiology? So anyone to give us the etiology?
Yeah, sure. Pardon?
Yes, Sister Julia, please give us the etiology.
The etiology is due to antibodies to thyroid antigens in the blood. Lymphocytic infiltration results in the destruction of the thyroid tissue.
Yes, thank you. And so the signs and symptoms are moderate thyroid enlargement, which is accompanied by pain and tenderness, like I mentioned in my case study. So they say dysphagia, often subtle symptoms that mimic other disorders, fatigue, excessive sleepiness, depression, cold intolerance, dry skin and hair, which I also mentioned in my case studies. Anyone to read us?
I'll go blood testing that will reveal elevated immunoglobulin levels and the presence of antibodies that react to thyroid tissue.
Yes, thank you. So we also have T3 and T4 hormone levels, which are low. So if you have this disease, then your T3 and T4 hormone levels are low. We also have TSH, which will be high. So I didn't look more into this disease to actually know what these symbols mean. And so the treatment is lifelong hormone replacement therapy for hypothyroidism, analgesics, anti-inflammatory drugs. So they say the prognosis is good with proper diagnosis and treatment. So this disease has no prevention. So there's no way you can prevent this disease, but it can be treated. So that's all that I have on Hashimoto thyroiditis. No more further research on the disease, unfortunately, but thank you. So anyone next? I think we are only left with Sister Tika and Elder Katere.
Okay, I'll go next.
All right.
An 8-year-old female is presented to your clinic. The parent narrates that the child has fatigue, anorexia, weight gain, low tolerance of cold, and muscle weakness. What could be the diagnosis?
Hypopituitarism.
Yes, that's the one. The description of this is endocrine deficiency, in which any of the hormones produced by the interior portion of the pituitary gland secreted at inefficient levels or are absent. For the etiology, caused by pituitary tumor or tumor of the hypothalamus, genetic mutation, pituitary vascular diseases, postpartum hemorrhage of the pituitary gland, head injuries, and hydrogenic damage. Who can help us with the
So the signs and symptoms, we are talking about hypopituitarism, right?
Yes.
Okay. So symptoms develop over a period of time, may be vague and easily overlooked. So it depends on the age and sex. Children, dwarfism, gonadotropin deficiency, fatigue, anorexia, weight gain or loss, loss of skin pigmentation, low tolerance of cold, muscle weakness, stiff joints, poor response to stress.
Yes, thank you. And who can help us with?
Well, they can use laboratory tests to measure levels of principal pituitary hormones.
Yes, thank you. And someone to help us with the treatment.
It's hormone replacement. It's hormone replacement therapy.
Yes, thank you. And Elder Kateria, wait.
Yes, I can hear you. I'm
Help us with
listening.
the
I'm here.
prognosis.
You want the prognosis, eh? So the prognosis it says good with adequate hormone replacement therapy.
Okay.
Total loss of hormonal
Yes.
secretions from the interior pituitary may result in fatal complications.
Okay, thank you. And so for the prevention, there's no prevention for this. That's all I had on my case study.
All right, thank you. So we are left with Elder Hatere. May you please share with us what you have?
Okay, I will share mine right now. So mine is Susan, the 26-year-old female who visits our local clinic, accompanied by a sister. She's complaining of muscle weakness and she's feeling pain. She also feels like she's losing weight and she has a craving for salt. She has hypertension, she has nausea, and she's also vomiting. What could be the diagnosis for this?
Can you please just do us a favor by reading again your case study?
I'm saying Susan is a 26-year-old female who visits our local clinic.
You are kind of breaking up a little.
Is that so? I think my internet is not very stable. Let me see if I can. Can you hear me now?
Yeah, it's your internet.
Yeah, I think it's my internet. I hope you
You're
can
still
hear me.
breaking.
I'm still breaking. Can you hear me?
Yeah, I think it's even getting worse.
It's getting worse. That's very unfortunate. Can you hear me so that I can? Can you hear me?
Unfortunately.
Can you hear me?
Yeah, but from what I've heard from his explanation, isn't it Addison disease?
Yes, it is Addison disease. Yes, Sister Julia, you are right. It's Addison disease. Yes. So what is the etiology for Addison disease? I think my internet is
Okay, so the etiology of arts and disease
yes.
is autoimmune infections or
Guys, can you hear me?
yeah, we are not recording this part, so I was just asking maybe one can just record it. Oh, he's back.
I'm back here, but I don't know if the recording that we did was saved because I did.
So Elder Katere?
Yes, can you hear me?
Okay. Yeah, we'll just have to check in.
Hello?
If the recording saved it.
Hello?
Yeah, I'm saying we'll just have to, you'll just have to check
Yeah, I'll
if
have to check
the
and see if
recording
the
was
recording was
saved.
saved because I'm not sure if it was saved now. Because my internet is actually playing some real tricks on me. So I will let you know on the group as soon as we finish the meeting. Then I hope you can hear me now.
Okay, so since
so you guys are still in. Hello, everyone.
Let us pray. Our dear Heavenly Father, we thank you for this day. We thank you for this gathering. We thank you for the gift of life. Be with us as we